I just want to officially welcome everybody to this week's masterclass here to Mind for All Seasons. And last week, we took a little bit of a detour to talk more about insulin and the timing of insulin and how that timing and some of our circadian rhythms can work together along with the decisions that we're making about how we fuel our bodies to get more optimal results. And Randy did a brilliant job with that. It stimulated a ton of really good conversation. And that masterclass ties in really well with some of the things that we're going to talk about today because we're revisiting how to read a roadmap. 2 weeks ago, Randy and I started this endeavor. We started combing through a redacted roadmap for an actual client and talking about the things that we see there and sort of going back and forth and sharing some perspective. And we want to pick up where we left off with that and continue that discussion. And we're just getting close in that redacted roadmap to talking about diet and how we fuel ourselves and how that affects us. And since we did so much time on that last week, I think everybody's a little bit more prepared for that part of this discussion. So without any further preliminaries, I'm going to dive into sharing my screen and showing this redacted roadmap again. And we'll kind of follow the same format that we did last time, where I'll make some commentary on it, and then Randy will offer some further ideas, and we'll have a little back and forth to try to help everyone understand how Randy and I see these things in a roadmap report, but also if you have your own roadmap report, how to understand these things. And even if you don't have it, or if you're serving somebody else, if you're working in long-term care, for example, and you're getting lab work on residents, knowing something about those specific labs will make a difference in how you support them and how you even talk to their families and providers about it. So last time we were talking about omega-6-3 fatty acid ratios and how important they are. And Randy, I don't remember if we actually talked about this person's 6-3 ratio. I think we went through that and then just haven't gone on past that. So let's pick up here and talk about magnesium and copper and zinc and selenium. These are nutrient metals, and magnesium is so impactful in the body. I remember years ago seeing a post from Dr. Mark Hyman at the Cleveland Clinic where he literally just listed all the things that magnesium does in the body and all of the conditions that magnesium deficiency is associated with. And it was pretty staggering. It was amazing to look at that and say, oh, wow, a lot of people struggle with those very kinds of things. Magnesium is essential at the cellular level to how the cellular engine runs. But magnesium in a standard blood test, a serum magnesium test, it very rarely is off. Randy, I think you've said in the past that if your serum magnesium is low, it means you're like 10 minutes from a heart attack, but it really isn't off for most people. Magnesium RBC is how much magnesium is bound to a red blood cell, which a lot of practitioners feel is a much more accurate measure, but it's something that insurance doesn't cover because even though that test has been around for many, many years, it's still considered experimental. And I guess the cynic in me feels like that's probably insurance companies just trying not to pay for it, or maybe providers haven't demanded it as much. But you'll see on this particular roadmap that this guy's level's 5.3, and optimal in the literature is suggested to be above 5.2, although I think some practitioners would argue that some people may need it to be even higher than 5.3. So even if this person wanted to supplement, we wouldn't necessarily recommend a supplement here. But if they wanted to prioritize dietary interventions to get magnesium up, like maybe eating more pumpkin seeds, for example, or if they even wanted to supplement because it was helpful with sleep, there would be no problem in doing that. Randy, what other thoughts do you have on the magnesium issue?
Many of the practitioners that I work with make their threshold for optimal magnesium at least 6.0 milligrams per deciliter. And I put the threshold at 5.2. So this is where we get into what's optimal and what's normal. And the reason that I haven't pushed it as aggressive to 6.0 as some of my colleagues are that oftentimes pushing the levels of magnesium with much higher doses will cause a little bit of loose stool in our clients. So in order to get that level to 6.0, you might have to take 2 or 3 different forms of magnesium in relatively high dosing a couple of times a day. And that it gives clients supplement fatigue. They just think, well, you've got all these other supplements and now you want me to take 2 or 3 different kinds of magnesium. You see my point. So I've kept my level at 5.2 as the optimal range, but individuals who have difficulty sleeping, difficulty pooping, they might have a lot of anxiety or they have muscle cramping. These individuals might benefit from pushing that dose a little bit more. So that becomes personalized, and oftentimes that's something I cover with folks when we do telemedicine.
One personal experience that I'll share with magnesium is that when I supplement with magnesium, if I push the level too high, I have just horrific nightmares. They are vivid, they are well formed, they are the craziest dreams imaginable. And I haven't heard other clients talk about that,
Mm-mm.
but it's a side effect that I have test driven multiple times. And like clockwork, within just a few days of supplementing aggressively with magnesium, I start having these wickedly vivid nightmares. And it is no fun. So I'm really thoughtful about that. And I get a lot of magnesium in my diet anyway, and I have an optimal level. But that was an interesting thing for me personally. Um, Copper and zinc kind of have a dynamic balance in the body. And ideally, the ratio would be 1 to 1, no higher than about 1.3. And one of the reasons that we look at this is that although copper is a nutrient metal, and we need to have some copper in our bodies, if you have a lot of copper, it's actually damaging for the brain. If you Google Wilson's disease, and Alzheimer's risk, you'll see that there's a really strong correlation. And Wilson's disease involves having excess copper in the system. So we want that ratio to be 1 to 1. And the way that you reduce excess copper, if it's there, is by increasing zinc. And you'll always see that if this is a problem, and if Randy's making a recommendation here, you will see zinc along with a recommendation for vitamin C. It might be regular vitamin C that you could get at the grocery store if you're looking for a lower cost alternative. Often, Randy will recommend liposomal vitamin C. It's a little bit better absorbed. But the reason for that is that zinc itself is not absorbed all that well, but in the presence of vitamin C, it's absorbed a bit better, and we get better results with that. A lot of people wonder, well, where is that excess copper coming from? So I want to call out the 2 most common reasons that a person might have elevated copper levels. One is that they're taking a multivitamin that has copper in it, and maybe they're also exposed to a bunch of other sources of copper. You can get copper in your meats depending on what the animals were grazing on. Sometimes people cook with copper cookware, or they have older copper piping in their home, and some of that copper sheds off into the water. The other most common reason that we see elevated copper, though, is birth control. It's almost predictable that when we see young women with grossly elevated copper levels, we know without them even disclosing it that they're taking birth control. Randy, what else would you add to the copper zinc discussion here?
Sometimes copper piping can be a problem, like I think you mentioned that. And it's really, we're looking at this balance because another common source of copper toxicity is supplementation. Sometimes you'll read an article that, oh, copper is so important for certain things, and people will supplement that, and if 1 is good, 2 is better, and 3 is the best. So sometimes just paying attention to what's in your multivitamin, or what is copper also a component of nutritional supplements, because really what we're looking for is that ratio. We'd like that ratio to be as close to a 1 to 1 ratio as possible. So we want about the same amount of serum copper as we get serum zinc. And if serum copper's going up and serum zinc's going down, it's an added risk factor for neurodegenerative diseases like Alzheimer's. So, though it's really hard to decopper somebody, if you have a high level of copper, we don't necessarily chelate it or try to pull the copper out. What we do is supplement with zinc to try to bring that ratio much more into equilibrium. And so, if your copper to zinc ratio is elevated, oftentimes the recommendation is going to be to start using a zinc supplement to try to balance that.
Thank you. Sometimes, Randy, have people that are worried about other heavy metals, and we've had really interesting cases of people with elevated mercury or elevated lead or arsenic or other metals that are toxic in the body. Um, is it accurate to say that for some people, elevated copper levels might be a flag that it's possible that their body's also hanging on to other heavy metals?
Yes, it is true. When there is a really strong imbalance in that copper to zinc ratio, Dr. Bredesen has said that this is a red flag that there may be other imbalances in metals as well. So this can be a trigger for then looking for things like cobalt toxicity, mercury toxicity, lead toxicity. All of these are considered heavy metals, and so if some of the metals are out of balance, it's likely to consider that others would be as well. I haven't seen it to be 100% direct correlation, but it certainly is a trigger of that. Dr. Bredesen says copper to zinc toxicity or copper to zinc elevation predicts other toxic problems.
Yeah. One of the things that those of you who've gotten a roadmap are aware of is we don't test for a bunch of those heavy metals and other neurotoxic substances in an initial round of testing. And most people never have that testing done because most people don't end up needing it. But if you get a roadmap report and you apply all the interventions, and let's say that your cognitive and or mental health is just not improving at all, then we know we're missing something. And when we go back and look at some of the initial blood work and we see, oh, they had elevated copper levels and their ALT, their liver enzymes are really elevated, which would be suggestive of an increased toxic load, then it starts us down the path of thinking, okay, maybe we need to test some of those heavy metals. We just don't want people to spend truckloads of money right out of the gate for something that they don't need if it's not going to change anything. Um, if we move to selenium, selenium's pretty important for brain health. And it's kind of like vitamin D in that there's a sweet spot. If you have too little selenium, your brain can't function correctly. And selenium actually plays a role in the methylation pathway that we talked about earlier in the report, but it has other functions as well. And like vitamin D, even though the two substances are totally different, there's a sweet spot. And if you get too high in selenium, it could be a problem, just like getting too high in vitamin D could be an issue. So we want selenium levels to be a little bit over 125. And sometimes we see people with levels that are like 90. I saw one that was 90 just the other day, and that's really trending in the wrong direction. So generally, Randy recommends a sort of 2-for-1 special. I really like Clearway cofactors from Quicksilver Scientific, both because it helps us to increase selenium levels, but it also has some ingredients that help strengthen the whole detox pathway. So you're getting a lot of bang for your buck with that particular supplement. Sometimes, though, if people are fatigued on supplements, or they're looking for ways to cut costs or just want a different approach, I'll encourage them to eat one Brazil nut per day and see if that increases their selenium level because Brazil nuts are very high in selenium. Interestingly, a few months ago, I was meeting with a client doing a review, and her selenium level had come back well over 300, which is definitely getting too high. And she wasn't supplementing with anything. And when I asked her more about it, we went down the pathway of some investigation, and I found out she and her husband love mixed nuts, but he hates the Brazil nuts. And so she eats all of them. And I said, well, how many Brazil nuts do you think that you have on a daily basis? And she said, "Oh, I probably have 8 to 10 every day." And I said, let's cut that to 1. So I thought that was kind of an interesting sort of serendipitous experiment that she had performed, and it taught me something about how powerful Brazil nuts really can be in somebody. Randy, any other thoughts about selenium and how important it is?
Selenium acts like an antioxidant in our body. It supports the glutathione peroxidase system, and it also supports the conversion of inactive thyroid to active thyroid hormone. So, individuals with thyroid disorders or with autoimmune thyroid disease or with any autoimmune disease wherein can become depleted, selenium is an important cofactor. And so, just like the other things that we've talked about, there's a sweet spot. We don't want it to get super high, like the client that Eric was talking about. And we also don't want it to bottom out. So, we're just looking at that as an additional risk factor of optimizing your nervous system and your immune system. So, that's why we're following selenium.
Great. Now, you used a word that a lot of our clients might not be as familiar with. Could you explain what a cofactor is?
A cofactor is something that helps a chemical reaction occur. So if I have gasoline and oxygen in an internal combustion fuel, that does not spontaneously combust on its own. I need a cofactor like a spark plug. And the spark plug ignites the reaction. And then once that spark is initiated, the reaction just occurs on its own. So a cofactor in the body is when a chemical reaction needs to occur and it won't initiate it on its own, it needs a spark, it needs a stimulus. That's part of what selenium acts as in those instances.
Excellent. And to tie this into an earlier part of the roadmap, you mentioned glutathione, Randy, and a lot of times when Randy recommends N-acetylcysteine, which is an amino acid that converts into glutathione, he also recommends glutathione recycler because it contains cofactors that help that whole glutathione synthesis pathway. So you might hear that term coming up from time to time in some of the things that we talk about, because that's just how biochemistry works. All right, let's launch into kind of a big area. We could spend days talking about this area. We don't have time to spend days in this area, but we've done a lot of master classes about metabolic health. And last week was a great example of that. Randy talked all about insulin signaling and timing, as I mentioned at the beginning of this. But if you want to understand metabolic health, there's a principle that I've shared even in our Healthy Foundations program, and I've talked about it with lots of you in coaching sessions and in other master classes. And the principle is that you're limited by the degree that you can measure something. So part of the enhanced protocol can be described as measure, learn, apply, adjust. You measure something that's really important for brain health and for overall physiology. You learn what the best research has to say about it and how to approach it and what would be optimal. You apply what you've learned, and then you make adjustments over time as you remeasure and you figure out, hey, am I moving the needle on this? Well, when it comes to metabolic health, many people think of metabolism in a really simplistic way. Like they'll say, oh, I have a sluggish metabolism. I look at a box of Krispy Kremes and I gain 5 pounds. But metabolism really has to do with how cells function and how they produce energy. And a lot of that has to do with getting fuel into the gas tank so that it can be converted into energy. So we've got to get glucose or ketones or lactate or acetate or some fuel source to the cell, into the mitochondria, so it can be converted into energy. Now, one sort of measure of metabolism would be stepping on the scale or even looking at how tight is your belt? How tight do your clothes fit? And if you're losing weight, in a lot of cases, that could be that you're improving metabolism in a way. So it's not entirely inaccurate to talk about weight gain, weight loss, and metabolism. They do work together, but you're limited by the degree that you can measure. So in a primary care visit, you get fasting glucose checked almost all the time. That shows up standard on a metabolic panel. So you want your fasting glucose level to be at least less than 100. And people like Dr. Robert Lustig, who's a noted endocrinologist, would say, ideally, if you're really metabolically healthy, your fasting blood sugar might be somewhere closer to 80 or 85. But that's one measure. And we want to check a little bit more. We want to go a little bit deeper because it gives us more perspective and it helps us to understand some things. So earlier today, for example, I met with a woman who's a client and she's relatively young and she has a fasting blood sugar that's well under 100, so that was great. And her A1C, which is a measure of how much sugar is bound to a red blood cell, was 5.0. That's awesome. That's really good. But her fasting insulin was almost 12. I think she was 11.8. And that is trending in the wrong direction. Fasting insulin ideally would be more like 4 to 6. So by measuring at a deeper level, we get a much more robust picture. So what I was seeing and talking about with this younger woman in in a meeting this morning was the fact that, yeah, she's young and her body overall is doing a pretty good job of keeping her sugars low, but her pancreas is starting to work a lot harder than it should. She's developing some insulin resistance. The trend is in the wrong direction. But her primary care doctor can't see that at all because they're only checking fasting blood sugar. So in this part of the roadmap report, we look at all these various parameters so that we really get a sense of whether someone is as metabolically healthy as possible. We want people to be metabolically flexible, to be able to burn sugar when it's time to burn sugar and to burn fat when it's time to burn fat. And we want to avoid hyperinsulinemia, too much insulin in the blood. And we've talked in other master classes about how damaging that is because literally every single tissue in the entire human body has an insulin receptor. There is no tissue in the body that doesn't react in some way to insulin. And that doesn't mean that insulin's the enemy. And sometimes when I meet with people, they think, oh, insulin's terrible. No, insulin's a hormone and it's an important signal in the body. And just ask a type 1 diabetic how devastating life is if you can't produce insulin because you have an autoimmune condition. Insulin is not the devil any more than sugar is the devil. But we have to understand how they work in the body and we need to control them in optimal ways. And that's one of the reasons why we spend so much time here in our master classes and in office hours talking about dietary strategies that work and principles that help us get the best results possible. So I've just dumped a lot of stuff out there. Randy, how would you respond to some of those comments about blood sugar, insulin resistance, diabetes, and metabolic health overall?
This I'm going to answer your question based on autism. And I have autism on my mind recently because of what's been talked about in some of the news press releases about the FDA and CDC making recommendations to reduce autism. And my point is this: all of our lives are touched by children or people who have autism. And everyone on here really clearly understands it's a spectrum disorder, meaning that there are people with very modest or mild levels of autism where they're very functional in society and they can hold jobs and they are happily married, they can have children, but maybe there's some characteristics in their social interactions which would say they're on the spectrum, right? And you contrast that to forms of autism where individuals are very impaired with behavioral disturbances. They have to live in group homes or assisted living centers because their level of impairment is excessive. Well, this is the same spectrum disorder in blood sugar and insulin that Eric was talking about. When we look at your fasting insulin, that's a predictor of what's happening in your liver. For example, most of you feel like your blood sugar is directly related to what you eat. Well, that's true, except when you're fasting. When you wake up first thing in the morning and you check your blood sugar, you haven't eaten anything since last night. So all of that glucose, all of that blood sugar is coming from your liver. And the response to that is your pancreas is releasing insulin. And so this becomes a spectrum disorder. How much insulin is your pancreas required to make to manage the blood sugar coming both from your diet and from your liver? As that spectrum grows, as we have more blood sugar and we require more insulin, the brain does not work as well. And that leads to brain fog, depression, anxiety, poor memory, Alzheimer's disease. It can be a contributor in almost everything. So if you look at the title in black, the title says blood sugar, insulin resistance, and diabetes impact on brain health, right? It's how is this all going to affect your brain? And that's really what this is about. Our goal is to help you as our clients keep your liver healthy, producing a low amount of sugar in a non-fasted state, help you eat less sugar just by virtue of paying attention, and then help your pancreas be more functional. And we do that through this dynamic of optimizing that spectrum of insulin resistance. I know that's kind of a unique way of saying it. I haven't said it like that before, but like I say, I've been thinking about the impact of these spectrum disorders, and really that's everything that we do. Everything falls on a spectrum of, am I doing really well? Am I doing really poorly? Or where do I fall in the spectrum? And I think that diet and blood sugar and insulin are a big part of that.
Yeah, thank you so much. I love that idea that it's a spectrum. There's a spectrum of dysfunction here. There was a question in the chat, and I think it's important to talk about. And the question was, okay, Eric, you talked about this young woman that was showing signs of some resistance to insulin signaling. What did you recommend that she do? The principle with insulin is this: the higher insulin goes, the less sensitive insulin receptors are. So it's kind of like yelling or other loud noises. If you're out working on the tarmac at an airport and an aircraft turns on the jet engines, you put on ear protection. So when the volume goes up, you down regulate. And conversely, if someone is whispering to you, you sort of lean in. You're more sensitive to it because you have to be. So the way to reestablish insulin sensitivity is to quit placing such demands on the pancreas. And you do that by reducing the carbohydrate load and even having periods where you're in a fasted state. Because when you're fasting, your pancreas doesn't have to crank out insulin other than to manage, like Randy was talking about earlier, whatever's going on in your blood sugars. And the more you're doing that and you're establishing sensitivity by not provoking so much of an insulin response, the more we see those fasting insulin levels coming right down. We've watched people whose fasting insulin levels were like 50 or 60 come back down over time. It doesn't happen overnight. Sometimes it might be more than a year, but gradually those fasting insulin levels come back down to a more optimal state. And in the process, people lose weight, they have better brain health and functioning, they feel a lot better. Because part of why we have an obesity epidemic in this country is we have a problem of hyperinsulinemia. Insulin is a growth hormone. And if you're constantly eating in a way that provokes an insulin response, you're going to pack on weight. And if you don't understand how insulin works in the body, you might make decisions that seem rational, but they're not going to be effective. I know lots of people who really try cutting their calories, but they're still getting most of their calories from carbohydrate. So they're still in growth mode. They're still flipping up the insulin switch. And it doesn't matter if you're eating 200 calories at your dinner. If it's all carbohydrate, you're still in a fed state and you're not in fat burning mode. So understanding that principle of insulin signaling, I think, goes a long way toward helping people be empowered to know how to improve their metabolic health. Now, there's lots more that we could say about diet. And Randy, I'll give you the last word here, but I would just say there's so many different master classes. There's principles in the Healthy Foundation section that you could review. There's a lot of content here in the AMFAS membership site that can allow you to understand these things in a more nuanced way. But hopefully this overview of how we look at this section of the roadmap and why it's important is helpful. But as we move on, Randy, any last thoughts about diet and metabolic health?
Well, Daryl's question was, what did you do for this lady? And if I was taking care of her, if I was being the coach, I would find out what her current lifestyle is now that's driving that insulin level up. Daryl, sometimes they're eating very low carbohydrate or very low sugar, and that insulin level's still up, maybe because they had a problem with their pancreas. Maybe this individual is skinny fat, which is defined as a very low muscle mass. So those individuals might need a little bit more physical activity. Maybe they need some weight-bearing exercises or some weight training. Other individuals can become very responsive to certain medications or nutritional supplements, right? There's some that really improve insulin sensitivity that are nutritional supplements, and there's medicines that can do it as well. So while I'm speaking generally, sometimes you have to really look at what someone's doing. I've had people who have terrible insulin resistance on a ketogenic diet. And if that's the case, diet alone will not fix it. We have to look at other opportunities. And then the flip side of that is I've had people who have terrible insulin resistance, and the only thing we did was adjust their diet, and they become very quick responders. So my response to that question has to be individualized based on the age, the past medical history, the current challenges that an individual has. And I think there's always an opportunity to find some ground for improvement.
Yeah, good point. And I'm probably dealing with some recency bias here because I know the rest of the story. And this was someone who has a BMI of about 35, isn't as physically active as she could be, and eats quite a bit of carbohydrate. And she's done a good job of cutting out alcohol, so that's going to help the whole picture. We talked about how to prioritize protein and good fats and plenty of vegetables, as opposed to eating lots of carbohydrates and ultra processed food and fast food and that sort of thing. And we talked about ways to incorporate exercise snacks in some thoughtful ways. She's got access to a lot of weight equipment. She just doesn't use it because she was making it a little bit harder than it needed to be. And those things, I'm pretty confident in her case, are probably going to improve her overall metabolic health and sensitivity to insulin. So we'll see how it goes. Okay.
Excellent.
Hopefully you get the thought overall, those of you listening, that this is why it's so important to have coaching. Randy has said a million times, the magic of what we do is in the coaching, because every single human system is unique, and you got to have some guidance because, yeah, we teach principles, but there can be a lot of nuances, and we can't possibly teach every last little thing that comes up that you learn over years of experience. Okay, shifting gears, let's talk a little bit about cholesterol, which unfortunately has been demonized in the modern world. And I think that's tragic because the reality with cholesterol is you would die without cholesterol. Your body synthesizes at least 70% of the cholesterol that's floating around in your body because it's an essential building block. We're talking, it makes up a lot of the structure of the brain. It makes up portions of cell walls and cell membranes. We need cholesterol. It's also the building block of hormones. And you might be surprised to find that in the research, having too low cholesterol is actually much more dangerous and correlates with greater all-cause mortality. So you're more likely to die for any reason than having really high cholesterol. That doesn't mean that you can't have real problems with cholesterol or that there's no impact with cholesterol and cardiovascular disease. They are connected, and there are reasons that they're connected. But I think we need to understand that cholesterol is essential, and what we need is healthy cholesterol. We don't want a body filled with damaged cholesterol. And once we understand the levers that affect those things, then we can start to make an impact. So even though most cardiologists like to see a total cholesterol under 200, and as soon as you flip over 200, you're getting a recommendation for a statin drug, a cholesterol lowering medication. There is researchers out there who believe pretty strongly that a total cholesterol level that's healthy might be in the neighborhood of 220. And Randy will correct me if I'm wrong, but I think our attitude for years has been total cholesterol is actually not that good of a predictor because about 50% of people in the hospital with their first cardiovascular event, like a heart attack or a stroke, have normal cholesterol levels, meaning their total cholesterol is less than 200. What matters a lot more is understanding things that are going on a little bit deeper. So you're limited by the degree that you measure. So, what are your triglycerides, for example? Triglycerides are produced by the liver. And when you eat carbohydrate, you first use whatever you need to in the moment. And then you'll store the rest of that glucose as glycogen in the muscles, but that's kind of a small storage tank. And what's left over, the liver tends to convert to triglycerides and store as fat. So if your triglycerides are over 150, often that means that you're just eating excessive amounts of carbohydrate, and that's what's driving it up. So if you're reducing your carb intake, usually it has a really positive impact on triglycerides. When your triglycerides are running really high and you've got a high A1C, your average sugars are really high, usually that also correlates to the particle size of LDL getting smaller. And I've talked before in a previous masterclass about the fact that with LDL, there's pattern A and there's pattern B. And you can think of pattern A as kind of like a beach ball and pattern B is like a golf ball. So think of what happens if balls are running down a gutter and they come in contact with a storm drain. The beach ball is going to roll right over the storm drain. The golf ball is going to go in the storm drain. If the gutter is kind of like a vessel in the body, and especially the endothelium, the layer of that that's kind of outermost that the blood is having contact with. If there's a tear in the endothelium and you've got a really small, dense pattern B LDL cholesterol molecule, it's likely to fall in there and get stuck. And that's one of the things that has to happen to start forming calcifications. HDL is generally recognized as healthy cholesterol. And a lot of people have really low HDL levels because they're not getting enough good healthy fats and they're eating the standard American diet. So if you've read a lot of roadmap reports and you've coached a lot of people through it like I have over the years, you will see Randy constantly recommending diet as the number one intervention to improve cholesterol. That doesn't mean that we're anti-statin or that there's no place for using a statin drug. And Randy's done some really thoughtful master classes on kind of how to navigate that thought process. But diet is the really big lever on this one. The Widowmaker heart attack on your cholesterol panel kind of looks like, yeah, you may have really high total cholesterol, but you also have sky high triglycerides and you have low HDL and you have really high LDL. That's a disaster. It's a totally different situation to have high LDL, low triglycerides, and high HDL. That's a different scenario, and it has to be treated a little bit differently. So, Randy, what else would you say about cholesterol management and rounding out anything that I've shared here?
Well, I think that this discussion on cholesterol is the most difficult thing to interpret on a roadmap. There is more misconception and more anxiety and more nuance built into interpreting your cholesterol than any other thing that we do. And because it's so complex, the cardiology world defaults to if it's high, take medicine. And I don't ever default to if it's high, just take medicine. I default to if it's high, let's figure out how much risk that might actually convey. If your cholesterol's high, is it actually sticking to the inside of your blood vessel? And we would figure that out with a coronary artery calcium score. I had a patient yesterday in my primary care office whose total cholesterol was 428. That is high cholesterol. And she says her cardiologist almost lost her mind and started 3 medicines at the very first consultation. What she didn't tell him is she'd been eating a low carb diet and she had lost 20 pounds. Well, what's happening in that instance is because she's losing the fat around her belly button and she's mobilizing that fat to break it down and metabolize it, it's temporarily inside her blood vessels. So it looks like she has this wicked high cholesterol, but she's actively breaking it down and metabolizing it. And so if all you can do, if the only thing we do is look at the number and make a decision based on the number, and we don't look at the context of what's happening in that person, we misinterpret this nonstop. And there's a whole group of clinicians that are weight loss specialists that say you should never check cholesterol in the midst of a weight loss program because you'll get artificially high levels and it will scare you out of your weight loss program. You'll just want to quit, and you shouldn't do that. So I've talked about this in a lot of master classes, and for the sake of our review today, I just want to amplify that I believe that lifestyle is always the starting point for minimizing cholesterol. I believe that if it's high, it merits additional testing. That might mean that if you have high cholesterol, we should also look at your uric acid level and your homocysteine level and your HSCRP level. And we should look at your dental health. And we should look at your insulin and A1C. We should look at all of those parameters. And if those parameters are all excellent and your cholesterol's high, then we get a coronary artery calcium scan. And then if your cholesterol level's high and everything looks good, I'm going to give you a high five and say, you know what? Your risk is actually quite low of atherosclerosis. Now your cholesterol's high, so if you want to take a medicine, I'll support you, but I don't just always default to that. That is very much a stylistic thing of Randy Vawdrey. It's why some people appreciate me and it's why others hate me, because they would just prefer to drive that level into the toilet. Just get your cholesterol as low as you can, and if it takes 3 medicines to do it, I'm on board. And if that's your style, I'll support you. But I think that that's not the most effective way to manage cholesterol. So that's my gentle way of just kind of conveying my perspective about how nuanced and complex interpreting labs are. The last thing I'll say is that that same patient from yesterday said, well, I'm really worried about my high cholesterol because it's genetic. My dad had heart disease and died of a heart attack. And I said, how old was your dad? And she said he was 86 when he had his heart attack. And my response was, that's not genetically high cholesterol. Okay? That doesn't have anything to do with it. Your dad died of a heart attack at 86. He exceeded the lifespan of most men by 10 years. So that's probably not the genetic condition. Now, I can't be insensitive and not worry because she's worried. She's panicked about that. But again, it goes back to that perspective of let's look at other variables and try to figure out why is it in the 400s and what are we going to do about trying to figure that out.
Great comments, Randy, that underscore the need for personalized precision medicine. Got to take it one case at a time and be thoughtful about it.
Yeah.
Okay, we're going to cruise through the last few sections here. Nootropics, you've heard us talk about nootropics before, those of you who've been AMFAS members for a long time. Nootropics are cognitive enhancers, and you find all sorts of supplements on the market that are marketed as nootropics. I think some of them are amazing. Some of them probably aren't so amazing. I'm not just a fan of selling truckloads of supplements. But there are 3 nootropics that Randy recommends really consistently. And I think it's important to understand why. Because they relate to things that you can't necessarily measure very easily. And maybe if we were Stanford University and we had all sorts of access to other equipment, we could do it. But we don't have a great way of measuring a neurotransmitter like acetylcholine. But acetylcholine literally impacts every aspect of our nervous system and how it functions, and it is especially impactful to memory. That is why there are drugs like Aricept that are designed to try to help people with an Alzheimer's diagnosis have more acetylcholine because it's so critical for memory. But the drugs do it by trying to prevent the breakdown of acetylcholine. So they work against the body's natural process. Versus if you supplement with a choline supplement, you're supporting the production of more acetylcholine. And our favorite one is acetyl CH active. Sometimes you'll see us recommend Parasim Plus, but acetyl CH active is a little bit easier to get a hold of. It's right in full script. It's an Apex product, but it actually has some other nice ingredients that really have been effective in improving cognitive functioning, especially when it comes to memory. So that is something that's both preventive and helpful for people who already have challenges. I will tell you, I personally have seen great benefits from using that in my own life, and I notice the difference if I don't take it. Neuro 2 is a specialty supplement from Apex Energetics. Dr. Karazian from Harvard and Loma Linda University has been involved in formulating a lot of these. He's an expert in neuroinflammation. And these next two supplements, the Neuro 2 and the NeuroFlam, are based on the idea that number one, to have a better brain, you got to have better blood flow. And Neuro 2 stimulates better blood flow to the brain through an active ingredient called vinpocetine. And NeuroFlam has a bunch of flavonoid compounds in it that in animal models are shown to actually make it past the blood-brain barrier, and they're very anti-inflammatory. And if you have cognitive or mental health problems, you have a problem of inflammation in the brain. And we want to give you something to help calm the fire a little bit. Randy, I know we have limited time, but do you have any other quick comments on nootropic sections?
No, I think you covered those very well. You gave a good succinct summary. The only thing I would add is that when people hear the word nootropic, I want you to think of the word caffeine. Caffeine is an over-the-counter supplement or ingredient, and everyone on this call knows a little bit of caffeine perks you up, perks up your memory. It increases your level of alertness. It can be overdone, and then you get a racing heart and you can't sleep at night, but it's a stimulant. It perks us up. That's what those other nootropics are designed to do. They can stimulate the brain, and when used appropriately, have tremendous benefit and function in individuals that have cognitive impairment. So that's all I want to say about nootropics. Just think of caffeine and then say, hey, interesting. I'd like to try something in addition to caffeine and see what happens. Those nootropics make a difference.
Excellent. Thank you. We've done other master classes on hormones and how impactful they are for brain health and bone health and our overall physiology. So I don't want to go too deep here, but in terms of how to read a roadmap report, there are a few things to know. One is that there's a big difference between normal and optimal. So we want you to get A's on tests, not not C's. Even though a C on a test, it's a normal score, but everyone knows there's a big difference between getting a C and getting an A. And it's important to know that the normal range in lab work comes from testing the general population and then throwing out the top 2.5% of the scores and the bottom 2.5% of the scores so that you're left with 95%, which is the normal range. Well, that means that the sicker the population is, the more that range gets skewed. And just because you fall in that range doesn't mean that you are going to have optimal health. So that comes into play in things like thyroid function. A lot of doctors will check thyroid stimulating hormone, or TSH, which is not thyroid itself. That's the signal to tell your body whether or not you might need to produce some more thyroid. And the normal range goes up more like to 5. But the optimal range, as Randy's listed here, would be more like 0.4 to 2.5. Now, free T3 is the active form of thyroid in the body. Free T4 is more the storage form of thyroid. We also check some things like thyroid peroxidase and thyroglobulin antibody that might be suggestive of whether you have an autoimmune thyroid condition. So you might see comments on those things in your roadmap report. Sometimes people get confused though, because they might have a free T3 level that, let's say it was 3.0, which is a little bit lower than 3.2 to 4.2. They might have free T4 that's like, maybe it is 1.4. That's not uncommon to see that. And maybe their TSH level is 2.0. Sometimes I've had clients say, well, aren't you going to do anything? Because my free T3 level, I mean, that's the amount of thyroid that's circulating. It's 3.0. And Randy said everything's optimal, but that's not optimal. That's not how this part of the roadmap works. Thyroid is pretty complex. And as bad as it is to have low thyroid, having high thyroid, being hyperthyroid, that's just as bad. You don't want to have a racing heart and be sweating all the time and feeling absolutely lousy and like you're having a panic attack all the time. And sometimes just improving lifestyle factors is enough to crank up thyroid a little bit. So it's not uncommon that you might see a TSH level that's a little bit outside this optimal range. And Randy will still say, we're not going to touch that. It's close enough. We're going to work on other factors. So I just want you to understand why that is, that we're trying to pay attention to a person and not just a number, even though numbers do tell us some important things. Randy, is there anything else that you'd clarify about that?
Yeah, one thing that I would mention is that thyroid is another nuanced area. If your thyroid function is just a tad low, most of your family doctors would say, nope, you don't need any thyroid medicine. But what if you were cold all the time? It's not uncommon that I can go into an assisted living center and see a sweet little 75-year-old lady sitting in the lobby and the temperature is 75 degrees and she's wearing a throw blanket and a shawl because she's cold. That might be a reason to add a little bit of thyroid medicine, and it's amazing what can happen neurologically when we do that. I had another lady that Eric's heard me tell this story before. I was at a high school basketball game sitting in the stadium, and this lady came running up the stairs, sat right on my lap. My wife is sitting next to me, sat on my lap and wrapped her arms around both of us and said, your husband changed my life because I can poop every day now. And I just started laughing because it was her thyroid that was off. Her thyroid looked normal, it looked okay. But the moment we added a teeny dose of thyroid medicine, now her pipe started moving a little bit better. Her constipation was as much a thyroid issue as anything. So there's nuance in there. If you're always cold, if you're always constipated, if you've got a lot of brain fog, and your levels might just be a little bit outside of normal, a little thought about thyroid medicine might be beneficial.
Excellent. I never get tired of the case histories and the personal examples of how these things come into play and how much they change lives. When it comes to other hormones, hormones that are generally labeled as sex hormones or reproductive hormones are also very neurologically active. They affect our brain health. They also affect our bone health, and they affect our overall well-being, our ability to maintain muscle mass over time. And so we check those hormones and we really try to help people optimize them. I'm not going to spend a lot of time talking about those hormones because there's other content about it. And many of those interventions would require a prescription, either through a telehealth consult with Randy or meeting with a different provider in your area or maybe your primary care doctor. But just be aware that we're interested in optimizing those because you can't have a really good brain without optimal testosterone levels. And women really suffer when their estradiol level drops as they age. And they don't just suffer in terms of having problems like chronic UTIs. They're suffering because their brains don't work as well anymore, and they're developing osteoporosis because bone cells have estrogen receptors on them. So make sure and come and have personalized interaction about those hormones. There are some hormones that are really neurologically active. but the treatment for them is over the counter in the United States. Pregnenolone is considered the master hormone for the brain, or the mother of all hormones, because hormones are built in a cascade. Cholesterol is the building block, which then turns into pregnenolone, which then converts to DHEA. And you go down one pathway towards sex hormones, like testosterone and various estrogens, and you go down another pathway towards stress hormones, like cortisol. And it's important to have good levels of all of those hormones if you want to have optimal functioning. So we measure those things and make recommendations based on what shows up in the blood work. Sometimes people get hung up on cortisol and they say, well, I thought cortisol was bad. You don't want to have too much cortisol. That's a stress hormone. I think that's a short-sighted view because all hormones have multiple different roles in the body. It's a complex symphony. It's not just as easy as, oh, cortisol is about stress. No, cortisol actually helps you focus and concentrate. And you need to start the day with a good morning cortisol level. You don't want to be super high in your cortisol level, but we see a lot of people like this where their morning cortisol level is 7.5. And optimally, it would be more like 15 to 20 or so. So this gentleman needs to double his morning cortisol level so that he has the ability to focus and concentrate and deal with stress that comes up throughout the day. And part of why he's depleted is his pregnenolone is not as optimal. His DHEA is actually doing relatively well, but he's probably experiencing a lot of stress, and he's just constantly burning through his cortisol stores, and his body can't keep up with that. So even some stress management here could be helpful. Any comments to add to those hormones, Randy, before we kind of bring it across the finish line with a few last thoughts?
Yeah, the one thing that I want to add is that we live in such a specialized society that there are very few practitioners that will manage hormones. So, for example, if you go to a neurologist because your brain isn't healthy, and one of the thoughts is that you might need hormone replacement to break your brain healthy, the neurologist won't do it. The neurologist will send you to an endocrinologist or an OBGYN or family practice or something that do that. This is the complexity here, is because hormones make the whole body work better. All the terrible symptoms of menopause, about 90% of them start in the brain. And so I can just tell you that a good brain optimization program that doesn't include hormone optimization is not a good program. You might say, I'm doing this really good program to improve my brain health, and if it's devoid of looking at the impact of hormones, you are missing a huge component of that. And so, and I came about this from a different perspective. I managed hormones for many years before I got really focused on brain health. And so it was a really easy transition for me to make when I started realizing, oh my gosh, these hormones do positively affect the brain. Every woman has told me that. They come and they say, I can't tell you how much better I feel. I'm sleeping so much better. My mood is so much better. I can find my words better than I've ever felt. And I heard this year after year after year managing hormones. And it took me a while to realize this same thing could happen in individuals with dementia, but they just have to have hormone replacement, and it's overlooked generally in society. So it's a big part of the enhanced protocol. Back to
Yeah.
you, Eric.
Awesome comments. Thank you. The last few areas are pretty quick to talk about. We check different inflammatory markers, and a lot of them are grouped in this section of the roadmap. One that is not grouped here is homocysteine, and we talked about that earlier, a couple of weeks ago. But HSCRP, or high sensitivity C-reactive protein, is a very general inflammatory marker. There are tons of things that could make that be elevated. If you have a significant cut on your body, your HSCRP could go up. If you have a dental health infection, it could go up. If you're sick at the time of the blood draw, it's going to be elevated. If you go to the gym and exercise like crazy, and then you go over to the lab and you get a blood test, your HSCRP is probably going to be elevated because you've stressed your body and you've had a little bit of an inflammatory response just from the workout. So you might have to wait 24 hours for that to come down. There are tons of things that could make it be elevated, but many people have chronically high CRP levels because they have chronic inflammation. And so this gives us an opportunity to see a problem and to start combing through potential triggers of systemic inflammation. Probably the most common thing that we see that's affecting that is poor gut health. And when people improve their diet and they start eating real food and the gut gets healthier, their HSCRP comes right down. We also check uric acid, which is, yeah, it's associated with gout, but it's also an inflammatory marker. And you want to have an optimal level less than 6.5. So this individual has some elevated uric acid. And primarily fructose is thought to be the biggest driver of uric acid, but there are other contributing factors, and there are ways that we can help you sort through that and figure out how to get that down. AG ratio is albumin to globulin ratio. There's basically two factors there at work. One is how much protein are you consuming? And two is what about your immunoglobulin levels? If you've got really poor gut health, your AG ratio might trend really low. If you don't eat enough protein, that could be a factor. Some people have both of those issues at work. And then if we scroll down, we get to some of the basic stuff that gets checked in a primary care visit. Your blood counts, and if there's something off, then Randy will call it out in the report. Sometimes we'll see people with a low white cell count, and that would be indicative that their immune system is struggling, and we might need to dig a little bit deeper there, or they might need to have some conversation with their primary care doctor to sort through that and try to figure that out. EGFR, or estimated glomerular filtration rate, is a measure of kidney function. How well is the filter working? And we want it to be higher than at least 65. So this person's kidney functioning is doing really pretty good at 91. We look at liver function tests. And if there's something off here, then Randy will recommend things. Overall, you should know that the glutathione levels that we test and talk about earlier in the roadmap report have a lot to do with how well your liver's functioning. And we see a lot of people that when they improve their glutathione levels, their liver function tests improve significantly. So those are the main things that we check in terms of biomarkers. A lot of the rest of the roadmap report reviews past medical history. Randy's really thoughtful and takes a lot of time to make comments here about what is elevating your risk factors, and he tries to stratify the risk. So you might read through these things, and occasionally we'll have people say, oh, well, that's not exactly right. Well, maybe you check something inadvertently on your health history, and we may need to clarify some things. But this allows us to look at various contributing factors and try to understand how much they're contributing to your results in terms of your cognitive testing and your overall functioning. You'll find some comments about toxicity that are helpful, some recordings that you could listen to, and then you'll get lots of commentary on lifestyle factors and links to various masterclasses to help you if you're struggling in some of those areas. And lastly, you'll end up getting some thoughts about what to do next and how to move forward and what else we might recommend. So that is an overview of a typical roadmap report. And hopefully by talking through it, it gives you a sense of how Randy and I think about it, some of the things that are important. This isn't meant to be an exhaustive survey of that, but we wanted to give you a sense of how we're thinking about those things. Randy, I want to give you a minute to respond to any of the last things that I brought up. I know I went pretty quickly there, but let's do that and then see if anyone has any questions as we're wrapping up our time for the day.
I don't think I have anything else. I was just thinking that the roadmap is my attempt to sit down with you in my office and go through risk factors of brain dysfunction and give you a written summary. I'll end with this thought. I've had a number of clients that come to my office. This is many, many years ago that they would come for their annual wellness consult. And they would get their annual wellness visit and they would get their labs back and their labs were normal. And I'd say, well, your labs look good. And they would say, well, how come I feel crappy? How come I feel like I'm aging 10 times faster than my sister? How come I can't remember things? If my everything looks normal, how come I'm not well? That's why I developed the roadmap, because the roadmap would say, hey, well, then let's look at the nuance. The last thing that I'll mention to you, and this is something that happens on a regular basis as well, is that people will say, hey, Randy, I have 10 specialists. I have a cardiologist and a neurologist and a kidney specialist and one of the clients that Eric and I do coaching with belong to an executive physical program where they see specialists all across the country and they do tens of thousands of dollars of studies. And when Eric sat down with them, Eric doesn't even, he hasn't prescribed medicine. He sat down with them and he looked at their stuff and he's like, oh, there's a lot of low-hanging fruit that we can fix here. And the gentleman said to Eric, hey, I've seen some of the world's best doctors and they didn't bring any of this up. So either you're making this stuff up or they're missing it. And I unapologetically said, your doctors are missing this stuff. They're missing it. This is not rocket science. This is stuff that should be paid attention to. Go back and ask your doctors, give them an opinion. Go back and say, hey, Randy asked, why wouldn't we drive this level lower? Why wouldn't we drive this level higher? And needless to say, they've come back and said, yeah, I'm feeling more confident. This is a good step. I'm not trying to pat myself on the back, but I'm just telling you that this stuff matters. And when you invest in a protocol with lab work and recommendations, this is based on the best science has. So there's my sales pitch, I guess.
Love it. I love that concept, Randy, that sometimes people go to their primary care visit, their labs look great, they're patted on the back, and they don't understand why they still feel lousy. And to add just one more thought about that, I think part of that is because if all you're looking at is basic organ systems and how they're functioning, you're doing a metabolic panel and you're doing blood counts, the only things that you're going to see are flags that, oh, this person needs to get to the hospital immediately because they've got a serious, serious problem, or this person might have cancer from what's showing up in their blood counts, or, oh my gosh, you're in chronic kidney disease and we didn't even know that, or your liver is shutting down. This is really bad. So you're always limited by the degree that you measure. And if you measure more at a little bit deeper level, and like Randy said, if you look at the nuance, you see things that help you get unstuck and to move forward in different ways and to even be preventive. So I
And
know,
Eric, I would add even my good friend Lainey is on this call today, and Lainey and I have met a number of times together. Lainey has suffered from migraines, and we have brainstormed a lot of things that have made them better. And I was really pleased when today Lainey says, I actually think I'm doing better. And I, just like every person, I'm like, what's the difference? And Lainey says, it's probably a lot of these little things that I'm starting to tie together on a regular basis. Neck health plays a role, manipulation plays a role, diet.
oh, I think he bumped something.
He got so excited
Off
and
he went. Well, Laney, you could speak to what he was saying firsthand. This is about you, but um,
yeah,
we're
I
just
mean, I think it is like what he was saying though. It's a culmination of like everything he's recommended. I've just been trying trial and error and I'm like, all right, well, it seems like it's a little bit of everything that I have to do.
yeah.
Hmm.
And so much of the body works that way. So um, it's not about one thing. It's about a lot of little things and stacking them together so that the body can do what it was designed to do. Now, as we come to the end, I know we've taken a little bit more time than usual even to go through this stuff because there's a lot to it. And we also want to have something that's sort of living in perpetuity in our masterclass recordings that people can refer to. But does anyone have any last comments or questions as we're wrapping up our time today? Daryl.
Eric, I should know the answer to this, but it's been about 2.5 years since I've had a roadmap. And I keep saying I need to do it. I need to get an update, and I want to get an update on my roadmap. What's the first thing I need to do?
Very easy to do that, Daryl. If you do you know how to log into the membership site?
I do.
Okay. If you go to services and you scroll down, you will find updated labs and roadmap. I want you to just click on that and it'll take you right to where you sign up to make that happen. And you can easily get it done.
Okay. Very good. Thank you.
Yep, you're welcome. Randy just texted me and said, sorry, amigo, my computer battery just pooped out on me. He didn't have his computer plugged in. So now we know. Any other questions before we wrap up here?
I'll ask another one.
Okay. All right, go ahead.
Not directly related to this, but I'm taking a number of supplements that you guys recommend, and some I'm on my own. But thiamine, I was taking one dose of the Benfomax of 200, and I updated it. Upped it to 400 in the morning, 2 tablets. And I've been taking a half a troche of methylene blue, and I changed it to one quarter of the block,
Yeah.
and or one half of it. Okay, so I'm taking 2 troches. I doubled both of those, and I think it's made a remarkable difference. I mean, I felt good, but I mean, I'm really feeling better, and I don't know if that's so. What does that does that help my inner ATP, or what happens with those two? And is there a should I be concerned about damages to my liver and with the extra methylene blue? I don't think B1 has anything to do with it, but
yeah, as far as the methylene blue, that's a good question to ask Randy for some nuance on that. He's done a lot more research on methylene blue than I personally have, so I would punt that to him. I doubt that would. Are you seeing changes in liver function, or have you
no,
had a test
I
lately?
really need to get an update.
Okay, so we'll look at that when it's updated. But as far as more energy and feeling a little bit better, both of those could have a direct effect, because methylene blue is a tremendous antioxidant that can play a role. It can be impactful. And thiamine is the rate limiting step in the citric acid cycle. That's what allows you to produce energy. So if you're pushing that, you see a result. I take 3 capsules of megabenfotiamine every morning, and it's like having a shot of caffeine. I used to use some caffeine for focus and energy, and it was helpful. And I hardly ever take caffeine anymore because the thiamine is so effective for me personally that I just feel a lot sharper when I take it. I notice it within 30 minutes of taking it. Not everybody sees that, but that probably means that I run a little bit more on the low side with that, and it's good that I'm pushing it.
Yeah.
Yeah, good questions.
Thank you.
All right. Well, it's always good to see everybody. Thanks for coming. I look forward to this every week. And we have some really cool things coming in both the membership site and in master classes. I'm so excited about it. Next week, Randy will teach, but the week after is when we're going to have Dr. Nick Wignall, who's a clinical psychologist who specifically focuses on anxiety and insomnia. And he's just a really neat guy, too. You're going to love him. And
What's his name?
Nick
What's his name?
Wignall, Wignall. And then at the end of October, on the 24th, Dr. Ryan Williamson is coming. He just published a book called The Incredible Brain. I've read half of it. It's amazing. And it's absolutely in line with what we do. He's a neurologist. He was a Navy doctor, but he's in private practice now. But everything that he's found and that he talks about is extremely supportive of all that we're doing here. I've had some really neat conversations with him. Just a great guy, and it'll be fun to have Dr. Williamson with us in October. So look forward to that. And with that, hope you all have a great weekend. We'll see you again next week.
Thanks.
All right. See you.
Bye.